If you've ever tried to read the eligibility criteria for medical assistance in dying, or MAiD, you'll know it's not always easy to understand. And even when the words are clear, it's not always obvious how doctors and nurse practitioners actually apply that criteria when they're deciding if someone qualifies for MAiD here in Canada. So today we're going to try and explain the eligibility criteria in plain language. We'll start with the basic non medical criteria before moving on to the medical criteria, what most people think of when they want to know if they're eligible for MAiD. First, the person has to be eligible for health services funded by a province, a territory, or the federal government. That could be something like MSP in British Columbia, OHIP in Ontario, or the equivalent program where you live. The key takeaway for most people is that there is no direct cost to the person. Medical assistance in dying is publicly funded in Canada. This one is fairly straightforward. A person must be at least 18 years of age. Being mentally competent means having the capacity to make important decisions. The question is, can the person make this decision at this time under these circumstances? There are different ways assessors determine whether someone has the capacity to request and consent to MAiD, but they're generally looking for four key elements. Can the person understand, appreciate, reason, and communicate? That means, can the person understand the relevant information about their condition and the available treatment options, including MAiD? Appreciate how that information applies to them, including that choosing MAiD would end their life, and what is likely to happen if they accept or refuse other reasonable options to relieve their suffering. Demonstrate a reasoning process as they consider their options and can explain how they arrived at their decision. And communicate a clear and consistent choice. If someone can do all four, they have capacity. And that standard applies whether someone is saying yes to MAiD, no to treatment, or making any other medical decision. This means the person is making the request of their own free will without undue pressure or influence from others. This doesn't mean they can't talk things over with loved ones or with their healthcare team. It also doesn't mean a medical professional can't include MAiD in a list of end of life care options if it's appropriate to do so. What matters is that the final decision to request and have MAiD is the person's alone. This ties directly back to being mentally competent and having capacity. Informed consent to receive MAiD can only be given by the person themselves, most often immediately before MAiD is provided. But unlike most other medical decisions, consent for MAiD cannot be given by a substitute decision maker or any other proxy, and it cannot be given in an advance directive. Consent has to come directly from the person themselves. Now let's talk about the medical criteria, what the law calls a grievous and irremediable medical condition. This is the big one. It's usually what people are thinking about when they ask, do I qualify for MAiD? The law says that a person has to have a grievous and irremediable medical condition. In plain language, grievous just means serious, and irremediable means incurable. It's important to note that this is legal language that has to be interpreted through a medical lens and in the context of the person's situation. That's what the MAiD assessors are doing. And while the phrase grievous and irremediable is broad, the law helps by breaking it down into three parts: the illness, the decline, and the suffering. As we go through each of them, it is helpful to think about them this way. The illness, disease, or disability is the condition. The decline is the loss that results from that condition. And the suffering is how the person experiences the condition or loss. Let's look at each of these in more detail. First, the person has to have a serious and incurable illness, disease, or disability. There is no list of qualifying conditions, as any list could quickly become outdated and would risk excluding people who clearly fall within the intent of the law. Instead, doctors and nurse practitioners rely on their clinical judgment. They look at the person's overall situation, along with their goals and their values, to decide whether the condition meets the legal threshold. When it comes to serious, we're usually talking about a condition that's significant, ongoing, and life altering, one that has had profound impact on a person's function or quality of life. Incurable is a bit more nuanced. It doesn't always mean a cure is impossible in theory. Sometimes it means that, for this person, there's no treatment likely to improve their condition in a way that's meaningful or acceptable to them. A treatment might exist on paper, But if it comes with a level of suffering, risk, or burden that outweighs its potential benefit, the person may decide that it is not an acceptable option for them. In that sense, incurability reflects both medical reality and the person's informed choices about what they're willing to endure. The second part of the medical criteria is that the person must be in an advanced state of decline that cannot be reversed. An advanced state of decline involves physical or cognitive losses, can happen suddenly or gradually, and may continue to worsen or level off over time. What's important is that it's assessed by a doctor or nurse practitioner and it's measured against the person's prior abilities. The third requirement is that the person is experiencing unbearable physical or mental suffering. The suffering must come from the illness, disease, disability, or the state of decline, and it cannot be relieved by any means that person finds acceptable. There's a lot to the suffering criteria, so let's break it down. Suffering isn't something that can be measured with a test or a scan. It's understood through the person's own experience and values, through what they've lost, what they can no longer do, and what has made their life feel no longer tolerable to them. And suffering can take many forms. It can be physical, pain, weakness, shortness of breath, or nausea, but it can also be psychological, such as the loss of the ability to participate in meaningful activities or to care for oneself. When people describe their suffering, they're often describing the shrinking of their world, the loss of independence, control, and the ability to live in a way that still feels like them. It's also important to understand that the suffering must come from the illness, disease, disability, or state of decline itself. It can't be caused by something like poverty, housing insecurity, or lack of social supports. Those issues absolutely matter, but they cannot be the reason a person has MAiD. And then there's the phrase, cannot be relieved under conditions the person finds acceptable. This is one of the most misunderstood parts of the law. It doesn't mean a person can simply refuse all treatment and care. It means they must be informed about reasonable options to relieve their suffering and seriously consider those options. They might have already tried some treatments and found them unhelpful. They may also reasonably refuse other treatments because, for them, the burden, the side effects, invasiveness, or impacts on quality of life outweigh any potential benefit. And just as someone needs the capacity to say yes to treatment, they also need to demonstrate the capacity to say no. The person must show they understand what they're refusing, appreciate what that refusal means for them, demonstrate they have reasoned through the decision, and communicate that decision clearly. If a person has been found eligible for MAiD, the next step is for the assessor to determine whether the person's natural death is reasonably foreseeable or not. You'll often hear this described as track 1 when a person's natural death is reasonably foreseeable, and track 2 when it isn't. This can be confusing, in part because there's no strict medical definition of what a reasonably foreseeable natural death is. It's a legal concept that clinicians interpret based on the person's full clinical picture. But in general, it means that death is reasonably predictable, and there is a clear trajectory towards death in the not too distant future. Unlike in some other countries, there's no requirement for a specific prognosis. A person doesn't need to be labeled terminal or be expected to die within a set time frame. There are additional safeguards for track 2 when a person's natural death is not reasonably foreseeable. You can find the full list of safeguards and the differences between track 1 and track 2 in our written resources linked below. But the most important thing for people to know is this. Track 2 includes a minimum 90-day assessment period. That means at least 90 days from the start of the first assessment to the day MAiD can be provided. Whether someone's natural death is reasonably foreseeable or not is determined by the MAiD assessors, and they will explain which track applies and which additional requirements are involved. So that's the overview. If this helped clarify how MAiD eligibility works in Canada, we're glad. But if you still have questions, you're not alone. This is complex, and it's okay to take time with it. If you have questions or want more information, you can reach out to us. We'll include our contact details below. Thank you for taking the time to watch and for sharing and supporting our work.